रधिपतिरसितो रक्षिता दित्या ईश्वा तेभ्यो नमो धिपतिभ्यो नमो रक्षितभ्यो नमो ईशुभ्यो नमः एभ्यो अस्तु योऽस्मान् तेष्टियं वयं दिश्मस्तम्भो जम्बे दद्मः। ओम दक्षिणादिगिन्दरोधिपतिस्थिराशचिराजी रक्षिता पितर ईश्वः तेभ्यो नमो दिपतिभ्यो नमो रक्षितभ्यो नमः ईशुभ्यो नमो एभ्यो अस्तु योऽस्मान् द्वेष्टियं वयं दिश्मस्तम्भो जम्बे दद्मः। ओम प्रतीचि दिग्वरुणो दिपति हृदाकु रक्षितान्विश्वा तेभ्यो नमो दिपतिभ्यो नमो रक्षितभ्यो नमः ईशुभ्यो नमः एभ्यो अस्तु योऽस्मान् देष्टियं वयं दिश्मस्तम्भो जम्बे दद्मः। ओम उदीची दिक् सोमो धिपति स्वजो रक्षिता शनिरिश्वः तेभ्यो नमो धिपतिभ्यो नमो रक्षितभ्यो नमः ईशुभ्यो नमः एभ्यो अस्तु योऽस्मान् देष्टियं वयं दिश्मस्तम्भो जम्बे दद्मः। ओम ध्रुवा दिग्विष्णु रधिपति कल्माशग्रीवो रक्षिता विरुद्ध ईश्वः तेभ्यो नमो धिपतिभ्यो नमो रक्षितभ्यो नमः ईशुभ्यो नमः एभ्यो अस्तु योऽस्मान् देष्टियं वयं दिश्मस्तम्भो जम्बे दद्मः। ओम उद्भवा दिग बृहस्पति रधिपति रक्षिता वर्षमिश्वः तेभ्यो नमो धिपतिभ्यो नमो रक्षितभ्यो नमः ईशुभ्यो नमः एभ्यो अस्तु योऽस्मान् द्वेष्टियं वयं दिश्मस्तम्भो जम्बे दद्मः। ओम उदयं तं सस्परिस्वः पश्यन्त उत्तरं देवं देवत्रा सूर्यमग्नं ज्योतिरुत्तमम् ओम उदुत्यं जातवेदसं देवं वहिन्त केत्वः दिशे विश्वाय सूर्यम् ओम चित्रं देवानामुद्गादनीकं चक्षुर्मित्रस्य वरुणस्याग्ने आप्राधावा पृथ्वी अंतरिक्ष गंग सूर्य आत्मा जगत्स्तुश्च स्वाहा। ओम तच्चक्षुर्ते वहितं पुरुस्ता शुक्रमुचरत पशेम शरदा शतं जीवेम शरदा शतं ऋणुन्याम शरदा शतं प्रब्रवाम शरदा शतमदीना स्याम शरदा शतं भूयश्च शरदा शतात्। ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। हे ईश्वर दयानिधे भवत्कृत्यानेन जपोपासनादि कर्मणां परमार्थका मोक्षाणां सद्य सिद्धि भवेन्। ओम नमः शंभवाय च वयोभवाय च नमः शंकराय च मयस्कराय च नमः शिवाय च शिवतराय च। ओम शांति शांति शांति। वेलकम एवरीबॉडी टू महिला समाज। और वो तो आ नहीं रही नजर मेरे को, दीपाली रत्नी कॉल है। I think she's having trouble logging on.
Hello, Jitendra ji. Hi, Prema.
Namaste.
Namaste. Happy New Year.
Happy New Year after a very long time. Yeah.
नमस्ते।
रानी जी आपका म्यूट हो गया था।
ना मैं दीपाली से
अच्छा।
अच्छा I think you have
Hi,
to have
Aradhana.
account with the Zoom, जो भी account है मेरे ख्याल में वो, because they want email address or something.
Yeah.
Yeah. When you get into Zoom, just join. Then yeah.
Hello, namaste Rani ji.
Namaste.
I just came in.
Deepali is having problem with the.
Oh no.
Hi, Rakesh.
Hello, namaste ji. Oh my goodness. So lovely to
Namaste.
see you. Namaste.
Yeah, Happy New Year.
Happy
Hi,
New Year.
Niruben.
Hi, how are you?
Namaste.
नमस्ते बहन जी।
Namaste.
I was talking to Deepali. She's going to try again. बेचारी वो कहती
Why
है
is she having trouble?
I'm doing through my office account, so let's see.
अच्छा।
संध्या तो हो गई.
हाँ जी, हाँ जी.
So
I guess because I was late, so that's why I guess.
Yeah.
ये
नहीं वो एक्चुअली में ईमेल में भी ना वो हाईलाइट होना चाहिए ना to in order to click on the
ईमेल में हाईलाइट होना चाहिए.
the Zoom link जो है ना वो आपका ईमेल में नहीं है इसलिए.
नमस्ते दीपिका जी. Is that Deepika? No.
नहीं
Deepika, she's trying.
Hi, that's what I thought. Namaste.
क्योंकि मैंने अपने WhatsApp ग्रुप में भी डाला था जो दीपिका भी है उसमें, तो so people, I'm glad more people are joining.
Yeah.
सीमा क्या हाल है? वीडियो ऑफ कर लिया सीमा ने।
नमस्ते.
Hi, Rajni. कैसी है?
Hi
क्या हाल?
Seema.
बहुत दिन के बाद देख रही हूँ।
आराधना कैसी है?
Welcome everybody.
बढ़िया सब।
तो सीमा जी आप कहाँ पर हैं अब?
हाँ, अभी वापस अपने ठिकाने अटलांटा.
अच्छा.
ठिकाना तो न्यूयॉर्क है, वो थोड़ी है, फ्लोरिडा थोड़ी है.
हाँ, ठिकाना तो पूरी दुनिया ही है. We just finished a 30 days world tour and came from Israel to Bahrain to India to
I saw your
Malaysia, Kuala Lumpur, Singapore,
lovely.
Indonesia, Thailand,
अच्छा.
Vietnam, Cambodia.
अच्छा.
And it was such a nice Tirth Yatra, you know. The
Tirth
best
Yatra?
thing was the Hindu culture in Indonesia and Bali is so good.
सब लोग बोलते हैं ना, सब लोग बोलते हैं. Nice.
You just admitted Deepali ji.
Oh, really?
Yeah.
Great.
So we'll go on mute now.
Oh, welcome Deepali.
Thank
Dr.
you.
Deepali Tewari.
Thank
We have a very
Hi,
nice speaker
Deepali.
today.
Hi.
Hello, namaste. Namaste.
I will,
Namaste.
नमस्ते, क्या हाल दीपाली?
welcome
Bas
everybody.
ठीक. I think this Zoom something has changed. Now I
हाँ,
have to
पता
put,
नहीं.
right?
हाँ,
Yeah.
मेरे को भी email because I have account, so I had to put in my email address and everything.
Okay.
Okay, let me just give a nice introduction for Deepali. Dr. Deepali Tewari, she's a board certified in pediatrics and gastroenterologist. She moved to New York from Dubai to join her family, leaving a successful career as a practicing physician and chief of division of multi-specialty hospital in Dubai. She was admired by her colleagues in India and Dubai for her tireless energy to provide patient care and exemplary leadership. Her decades of clinical experience in treating patients from diverse cultures and ethnicity across the globe, her innovative and refreshing approach has made her highly sought after consultant in Hudson Valley. So she plays a pivotal role in developing dysphagia program, swallowing program, in other words. Special emphasis on eosinophilic esophagitis. She is board certified in pediatrics and gastroenterology. Her expertise includes endoscopy, colonoscopy, PhilCam endoscopy studies, anorectal manometry, and esophageal manometry. She has published several research papers, is involved in
Hello.
clinical and is teaching at New York Medical College.
Namaste Maharaj.
She has been a distinguished guest speaker in national and international meetings and has received several awards and honors. This is a short introduction. So welcome, Dr. Deepali. And
Thank you, Rani ji. Feels you calling me Dr. Deepali feels like very distant. So
welcome.
thank you everybody for giving me this opportunity. And I discussed with Rani ji that I will be using this platform today to raise awareness about the swallowing disorders. And she specifically instructed me not to go too deep in medicine and try to explain things in simple terms. So I will do my best to talk in simple terms so we all can understand. And I will try to do it fast so that we have some time if anyone has questions for me and we can go over the questions. Now, the thing is, how do I share my screen? I have my presentation. So that will be another thing. I'll say share screen, right?
Jitendra ji, आप इनको
Host, right? Host has disabled.
Co-host बना दो इनको ना, दीपाली को.
Okay.
You are the host, right now?
Not yet.
No, I mean, I'm asking Jitendra ji to make you host.
Right. Seems
Okay.
like it's done. So now I'm going to share my screen. So I think you all can see this.
Yes.
Right.
Yeah.
Okay. So let's do the full. So this is my name and I am a GI, as Dr. Rani Singla already informed everybody that I work at Westchester Medical Center as a part of Boston Children's Health Physicians. And I am also a consultant at Phelps Hospital and Garnett Hospital in Orange County. I also do the teaching and training of the medical students and residents and the GI trainees at New York Medical College. So this is me. Now, moving on to dysphagia. Dysphagia is nothing but a problem in swallowing. And any sensation or any difficulty in swallowing the food or the liquid when it goes from your mouth to your stomach, we as a medical people call it dysphagia. So what actually is a swallowing disorder? Or lots of us, many of us, they experience difficulty in swallowing randomly. Some people experience swallowing issues on a daily basis or more frequently than others. What happens is, by the time we grow or by the time we are an adult, we try to adapt our eating patterns. So the symptoms we have, the swallowing disorders, are kind of masked. So what we do is we either try to eat softer food or we try to eat the more liquid food, or if the liquid bothers us, we try to take more solid food. We start avoiding the food, which kind of gives us symptoms. The children, they are difficult also. They can't tell you what's going on with them. So when they start avoiding the food, they are called picky eaters. Now, if we leave this unrecognized problem, what happens is it increases the risk of aspiration, and it increases the risk of malnourishment in children, causes ulcers. In long run, this can cause stricture of the food pipe or even malignancy. So I do see patients, and the reason behind today's presentation is I do see patients coming to me as a referral after years of suffering. And then what happens is, by the time I get to them, the disease is already progressed, already complicated. So it takes us longer time to make them feel better. And I'll show you what happens when the disease progresses. So I do get referrals from around the area. Even the patients from Albany come to us. And when I go to Orange County, they are referred to us because there's no such specialist who just deals with the feeding disorder. And we do have a program here at Boston Children Health Physician. So if you have the symptom, I would say there's no harm in speaking to a gastroenterologist, get it diagnosed so you don't get into the complications. So to begin with, the question is, what is swallowing? It is a complex process which we are not aware of. We have been doing the swallowing on a daily basis. It involves the voluntary and involuntary muscles, and it permits the coordinated breathing and swallowing. So when we are swallowing, the food doesn't go into the air pathway so that we don't choke or cough. It is a very, very complex mechanisms, but we've been doing it unknowingly, so we are used to it. It is divided into two stages, the oropharyngeal phase and the esophageal phase. The oral phase is when you chew a food, you mix it with the saliva, you form a bolus, and it's in the mouth and goes further. The esophageal is the second stage, when the bolus we have made in the mouth passes from the upper sphincter of the food pipe to enter the food pipe, and then it goes into the stomach through the lower sphincter. Now, any of these complex mechanisms can fail anytime. And when they fail, that's when the problem of swallowing begins. So these are the common problems that can lead to swallowing problems in the children and in the adults. These are 5 groups, and every group has almost 8 to 10 issues. So I'm going to talk about all of this today. So bring your dinner so we can sit until tomorrow and discuss all this. So what are the symptoms? If you have a swallowing disorder, the symptoms usually are you have difficulty either in swallowing process or even initiation of the swallowing, the beginning of the swallowing. People get cough when they are eating. They also have choking episodes during their meals, or they come to us saying that they have regurgitation, reflux, which is the food coming up to the mouth and they swallow back most of the times, or some people start spitting the food out. They complain of heartburn. Speech can become little nasal for them. So when you hear or talk to them, there's a nasal tone. Then they also tell you that they feel that the liquid or the food they eat, it doesn't go down easily. It kind of goes down slowly. Sometimes they start telling us that the food is stuck in the throat or stuck in the chest. And what people adapt to this is they start drinking tons of water with that. Or you see the children, they'll ask for liquid or they'll ask for juices when they're eating, and they'll drink more of the liquid than they will eat the solid food. So this is the adaptation. When people are having the symptoms, they try to adapt to the food which bothers them less. What happens in the children? We all have kids, and we see that they're different kind of presentation in children. They have, again, feeding problems. They will be a picky eater. Then the growth suffers. In the adults, the growth doesn't suffer too much, but for the kids, when they don't eat well and they're malnourished, they either become short-statured or they don't gain weight. Then they start choking, gagging, and vomiting with the food in the later stages, or they come to the emergency in the middle of the night when I get called and I have to go at 2 a.m. to take the food out from the esophagus endoscopically, which I hate because it disturbs my sleep. So I want to diagnose earlier before they reach that stage. Or there is a reflux which is there for years and years and it's not responding to treatment. Again, there is difficulty in the eating and swallowing patterns. They have fear. They have so much scare of eating and irritability during meal times that most of the people say, I don't want to sit with this kid while we're having the dinner because they are so irritable. They can be nauseous. There can be pain in the belly, or there can be heartburn. They can also report trouble sleeping at night, or the child bothers the parents in the nighttime saying that the reflux is there or the child is not getting a good sleep. The most common cause of these swallowing disorders so far, which we have seen in my practice, is esophagitis in the pediatric population. So esophagitis is nothing but an inflammation of the food pipe. This inflammation can cause swallowing and feeding issues, and the entity which is getting more and more popular and more common is eosinophilic esophagitis, which I specialize in. So what is eosinophilic esophagitis? It is again the inflammation of the food pipe. And your food pipe, when we do the biopsy and endoscopy, we see that it is loaded with a special kind of cells, which are called eosinophils, and that's how the name is eosinophilic esophagitis. So that presents, as we discussed already, in the younger kids in the form of feeding disorders, vomiting, bellyache, choking, gagging, food impactions, and later on, when they are adults, they present with choking, gagging, of course, but GERD. GERD is gastroesophageal reflux disease, commonly known as heartburn, or as the bellyache. People get frequent bellyaches, people get frequent heartburn, and they come to us saying that these are the symptoms, they're not getting better, no matter what kind of food changes I make. So then when they come to us, we perform the endoscopy, and in the endoscopy, we see that this is the food pipe that looks white, and this is the plaque you're seeing. This plaque is, the white plaque comes from the microabscesses, the small pus-filled areas which starts to make a plaque around your food pipe. This is how it is visible to us. We have these furrows. If you notice, there are the furrows along the longitudinal line of the food pipe. They are the cuts in the esophagus and also indicate the fibrosis. Then you see the fragile mucosa, there are ulcerations, and this is how bad it looks like. These are the rings. Once you're very late in the game, then your food pipe kind of starts to get constricted. The rings are formed, and now it becomes so narrow that sometimes we have to do the dilatation of the esophagus. So we do have patients who have a long-standing disease, and later in the years, their esophagus becomes so narrow that they can't eat the food. I have 2 patients in my practice who cannot eat anything by mouth. It's such a bad situation that we have put a peg. Peg is a connection or a tube, a mechanical tube which is put in your stomach, and the patient is fed from the stomach instead of feeding through the mouth. There are other patients who we put a narrow tube through the nose so the parents can feed the child on a daily basis. And sometimes it is this that we bring them every few weeks or months to us to dilate the esophagus so that the esophagus is opened enough to facilitate the swallowing of the liquid contents. So that's how bad it can get. And it definitely affects poorly and adversely the lifestyle of the patient. So what do? Our job as a gastroenterologist is to evaluate, then make a diagnosis, then to treat the patient so that they feel better, and then we follow up on them so that they don't get reversal or recurrence of the symptoms. So we have a team. I have a team of the physicians in Boston Children. We have the team of pediatric gastroenterologists. We have allergists, immunologists, ENT physicians, speech therapists, etc., and the dietitians. Accordingly, depending on the symptoms, when somebody presents to us, they get a comprehensive evaluation. We get their medical history. We do the physical exam, review the labs, results, and the medical records. If you have not done anything or have not seen, if you're not coming to me for a second opinion, then you don't have any records. Then we start the evaluation process. We perform all the tests here. And then finally, you get an endoscopy to know at what stage you are, and then accordingly the treatment is suggested. So we perform certain blood work. This is what we do. We use the radiological tests depending upon how you are presenting, endoscopies, enzyme testing. I also do the esophageal manometry. So in the pediatric population, it's myself and there is another gastroenterologist who is in Cornell who performs the esophageal manometry in the whole Hudson Valley area and the city. So that's one study. Video capsule study, food allergy testing, laryngoscopy, then nutritional guidance and feeding evaluation is also done as a part of the evaluation. So this is an interesting case. I just wanted to show you. This is one of the patients who presented to us with long-standing history of unable to feed. The child was initially labeled as a picky eater. They took the child first to the developmental pediatrician, then to a therapist, behavior therapist, to have the child eat. Finally, when nothing was working and the child was like kind of started refusing more and more foods, they came to our attention. And when I did the endoscopy, you see on the first picture on the left, this is how much swollen the esophagus was looking, how much swelling. You see that this was so many cuts there. The first two pictures on the left, the top and the bottom, they're showing how bad the food pipe was. We started the treatment, and following the treatment, this is how the middle picture is following the treatment. Of course, the child started feeling better. And as we all do in general, when we feel better, we say goodbye to the doctor. And they did say goodbye to us because now the child was eating and feeling good, and there was no problem, no vomiting, no choking, eating everything, growing. 3 years down the line, the symptoms started to worsen again, and then the child was sent back to me. And you see the last picture on the right. This is how it looked second time. And now we see again all the presentations we were seeing the first time are coming back. The plaques are coming back. The abscesses are coming back. So this is how. So one thing to remember here is the eosinophilic esophagitis, it doesn't go away. It stays. So I also call it as an asthma of the esophagus. Why? Because if you don't treat it, it's going to come back to you. So if you keep it under control, you'll be fine. You will have no problems. But then you have to remember that this is going to come back. If you're feeling good, do not leave the follow-up. Do not leave your management plan. And this is another case. You see, these are the different endoscopic pictures of my patients where I have evaluated and I have treated them. If you see the first picture is still better, but there's slight narrowing at the end. The second picture, you see how narrow is the sphincter, how small is the sphincter, and so difficult it is for them to eat. The third picture on the top shows you the rings, and these are the rings which are telling me, okay, do something now, or this is going to be a big issue. So is the picture on the bottom, which are telling us that this esophagus is in trouble, needs help. This is the bad picture, one of the serious cases we saw, which has lots of ulcers, you see. Now the patient has tearing the mucosa, ulcerations, and sloughing. Now the skin of the food pipe is sloughing out. So this is my team. We work at Boston Children's Health Physician. The adult GI is the interventional GI we have in our team is at WMC. Then we have the allergist, and we have the ENT physicians as well, and a cardiologist. This is my contact. You can have my office number if you want to. You can have the adult GI office number if you want to come and talk about yourself. Then this is the number for adult GI office. And if you want to bring your child or a kid, then the number on the top is my number. Thank you very much. This was from last year. Thankfully, in New York, we don't see this much snow this year. It's all our good karmas.
Right.
So I'm ready for the questions. Please shoot.
I have a question, Dr. Deepali ji.
Yes, please.
I'm a pathologist. And of course, after you see these patients, you biopsy, and obviously you send them to us. And as you mentioned, of course, we see a lot of EOs and we assess how bad and all those things.
That's right.
Somehow, in my experience, the number of cases that we've gotten so far, they always give a history of foreign body. And for one reason or the other, many of the physicians tell us that there was, when they're eating some non-veg food, the bone gets stuck. Now, is that relevant?
Well, this is true. That's the dysphagia, and that's very common presentation for all the teenagers. So they come with either food getting stuck or they come with the bone getting stuck. And You won't believe this year I was on call for the Thanksgiving, and we all dread, we fight that we don't want to be on call. So this year it was me, and I was on call, and I had to go a few times to take one time was the bone out, one time was the food bolus out, and they all eat turkey. They have big parties, and yeah, it's very common presentation. Now, the other part of the question was the foreign body sensation. They do have the foreign body sensation because if your esophagus is inflamed, if the child talks, they will tell you, I feel something is hurting me. So that's a very real sensation. And I would say if somebody is telling you, they should get the attention. And yes, thank you as a pathologist. You are our right hands and you guide us towards the confirmation of the diagnosis.
Now, my next question, I'm sorry, I just have one more question.
Yes, please go ahead. Yeah.
I know that for teenagers and for adult patients, they usually give steroids and all those things. What about children?
Well, that's a great question. So there are two ways to manage the eosinophilic esophagitis. The one is, which I believe in, is the diet change. Most of the places will not, especially with the adults and all, they don't have too much time to go over with you with the diet changes. So they say, all right, I can't do anything, just take the medicines. So now we have the medicines which are until May 2022, we had only the steroids as an option for the pediatric cases. For the adults, we had the biologic 2, which we use as a shot, weekly shots. But now in pediatrics, it is also approved above 12 years. Below 12, we only have steroids to use. And the diet management is very specific. You have to sit down with your GI. You have to have somebody who has an experience in that and who is willing to sit with you, which is very hard to find. Somebody has time to sit down and go over the diets with you and plan with you. Younger the kid, better is the diet management because the parents control the diet, so it becomes easier for us.
I see. Okay, very good. Very informative. Thank you.
Thank you.
Deepali, I wanted to ask something. तो ये जो acid reflux जो होती है बहुत,
right?
क्या वो it may lead to issues in esophagus later in life?
Well, that's another great question. So a long-standing reflux disease. Thank you, Rajniji. Any long-standing reflux disease, it's different. If you are a child, when you're born, you're refluxing all the time, and we tell parents, look, this is normal. But after you're 1 or 2 years old, after that, the reflux is not a physiological thing. So you need attention. But as an adult or as a teenager, if you continue to have reflux, this can cause erosion of your food pipe, and a constant insult to your food pipe later on can convert into malignancy. So that there's a name called Barrett's esophagus, which people get because they have constant reflux and they end up getting esophageal cancers. So if somebody has that, it's the best idea to go and get yourself evaluated. It's a simple test, and once you don't have it, then you can sleep peacefully.
Okay. So, yeah, I saw some procedure named laryngo something.
That's right. Laryngoscopy, yes.
Laryngoscopy.
So laryngoscopy is a procedure which is done by ENT people. So ear, nose, throat people I have in my team. If somebody comes and they tell me they always have a cough sensation when they eat, they start coughing. So if I don't find anything, I also want my ENT to look at it. So they have some vocal cord dysfunction, and when they eat, the liquid may trickle into the airway. And if it trickles into the airway, it will lead to cough. So that's how the kid is presenting, and then that's when we perform the laryngoscopy. Sometimes we do the laryngoscopy together. So I'm doing the endoscopy while the child is sleeping, and my ENT colleague does the laryngoscopy at the same time, so that we don't have to make the child or sedate the child twice.
Okay. So laryngoscopy, that is done while the patient is sleeping?
Well, if the patient is non-cooperative, then we have to put them to sleep. All patients are very non-cooperative if they're too young. But if you are an adult, you can get it in the office without the sedation also.
Okay.
Yeah. Looks like you are on mute.
If nobody has a question, I'll ask you another one.
Yes, go ahead, please.
I saw these pictures. They look pretty bad. However, when we look at the biopsy, of course, we calculate the number of EOs per high power field and all those things. So you mean to say there is superadded infection on that? Or even if you take that very bad looking area with ulceration and all that, still you think it shows just EOs?
Well, yes, I have seen very, very bad EOE, eosinophilic esophagitis, with just the EOs, but they do see basal cell hyperplasias and I get report that there is a lot of heaped up granulation tissue. And the worst cases which I was showing, they had suppurated fungal too. I mean, any experienced pathologist will catch it. So because this was an awareness thing, I want to show that to say that, okay, it can get to that extent. I did not know I will have a sharp-eyed pathologist sitting in the...
Your presentation was
thank you.
Very well done.
Thank you.
Extremely well.
I have a question. If
please, by all means, yes.
This is Sudesh Kapoor. First of all, your presentation was extremely helpful, and it is, it made me sort of realize there's so many things that one doesn't know, that at least I was able to understand a little bit better. Now, I have a question is that I know you're with the pediatrics and all that, but
that's right.
Yeah. So the thing is that in adults, let's say, for example, there's esophageal mobility, or whatever they call it. Caused basically due to an autoimmune condition called the crust. What is the, have you seen that, or any, can shed any light on that, or what exactly is it?
Well, yes. So esophageal dysmotility disorders, there are multiple causes to that. Autoimmune is one of them. And if you ask about the crest, I have not seen, or I'm not managing any patients with crest, because again, I see kids below 18 years of age or up to 21. That's my max. I haven't seen that, but I have studied about them. I have seen other people managing in the adult GI world, because we do our conferences together. So they do have a big dysmotility program also, and they do talk about it.
Okay, and that can be detected through endoscopies, or?
Well, you need a full 360-degree evaluation to come to that conclusion, because what endoscopy does is it only gives you the biopsy. Then the motility, it doesn't tell you whether your esophagus is moving fine or not. For that, you need a catheter which we pass through your esophagus, and we check your motility. So if let's say your esophagus looks fine, and now I put the catheter and I see it's looking fine, but it doesn't move, so that's a dysmotile esophagus. So it means your mucosa is looking okay, you don't have esophagitis, but you have a problem with the esophageal motility, and both will give you problem in swallowing.
Thank you.
Sure, you're welcome.
Just one question from me. I know you said picky eaters, right?
That's right.
So a lot of kids are picky eaters, but generally you go for a physical and you expect that the doctor is gonna look at all the reasons why the kid is not eating and take it from there. But at what stage? I mean, I know what you presented was very advanced, but at what point should they actually be seeing a gastroenterologist?
So this is a great question again. That's what I teach when I teach the students and the residents. When you see a red flag, I mean, picky eater, most of the kids are, because they like one thing over the other, but there are certain red flags. When you see those red flags, you should refer them to a GI. The red flags are whatever the parents are doing, the child is not gaining weight. So if the child is not gaining weight, there is a growth issue with the child, or the child is gagging on the food. You're eating and you're on the dining table and suddenly the child is gagging, and it's not one time, it's very frequent. You need us. Gagging, choking, you see the child bringing the food to the mouth all the time. You can observe the child brings the food, and if you say, what's that, they swallow back. So this is regurgitation. They are regurgitating. Sometimes you see the child runs and spits out the food, and not one time because they're mad at you. It's very frequent. Even the food they like bothers them. So those are certain red flags. They are vomiting, they're telling you frequent belly aches. Then yes, I would like to see the kid.
How long is the treatment?
It depends which way you want to go. Whatever you choose, it's lifelong. Yeah, there is no getting away with EOE. So I have had huge success with diet elimination. So why I feel is because there was only steroid in until 2022. And when I talk about steroid, I don't feel too comfortable prescribing steroid to somebody for the rest of his life. I have a 2-year-old, I have 4-year-old patients coming to me, and then their parents are very educated these days. So they come to me and they say, okay, do you want my child to have steroids for the rest of the life? And this question kind of wakes you up. What are you doing? So then I don't believe in steroids for that long period of time. I do the diet, and I have been getting huge success with the diet elimination. So once we figure out what food is your problem, so let's say 90% of the times, or 80 to 90% of the times, we find dairy is the problem. So we tell them, okay, how about you start avoiding the dairy? And they start avoiding the dairy, and we see the esophagus is clear. So if that's the problem, then we suggest them not to take dairy for the rest of their life, which is very natural treatment. So some people have dairy. There was a patient who we were, sometimes the parents are very, very, I would say, determined. They read about it. This family lived, I think they live somewhere in Bronxville. The father is, he is a CEO somewhere, and he reads a lot. And he's a financial guy. He comes to me with the paperwork and says, look, this patient got this patient had this. You have tested everything. Why you're not able to find out what my child has, so we can stop giving the food. So we have a limited amount of food which we can test, the 6-food elimination diet we do. Ultimately, because the parent is so adamant, we will be able to figure out that this child has a problem with potato. Who on earth will think about potato? And it's not even in the list of the most common food allergens. But once we stopped giving him the potatoes, he's totally fine. He has no recurrences. And matter of fact, 2 weeks ago, they came back and they're totally fine. So no French fries for him, and rest of the things are fine.
Very nice. Very nice.
Yeah.
तू भी अपनी पूछ लेना ना यार ऑन करके
Another question.
ना खड़ा कर करो
डाइट तो बहुत ही बड़ा रोल प्ले करता है.
Yes. Easier with the younger, but if you are a teenager, the teenagers are very poor in following a diet. I tell them, don't do this, don't do that. They come back, oh, I was with a friend, or I was at the college. It gets very hard with younger kids. Yeah,
A lot of junk food too.
Yes, junk food too. And it's hard when you are partying with your friends, with your peer group. You can't say, okay, I'm not going to eat this, I'm not going to eat that because Dr. Tewari told me not to eat. So it doesn't look cool.
Yeah.
There's somebody who's wants to ask a question.
Sure, please.
Yeah.
Raised hand.
Hanji.
Sunita bolo.
Yes,
ahead.
I want to ask my mom. She has a swallowing a problem. Her food pipe doctor did her what you call
Manometry, endoscopy. Okay.
endoscopy, and they found that her food pipe is like this, but her food pipe is like this,
Narrowed.
narrow, and she cannot swallow the food. She cannot. I give her pureed food.
Yeah.
But the thing is that is not sufficient for her. She can't. She throws up the things. She's throwing up the things, and
So can I ask you, who is your GI? Who's your gastroenterologist?
is Dr. Enfang. Yeah,
Okay.
Islam. Is in Northwell Hospital.
Northwell. Okay. So if first of all, do we know what the diagnosis is? Did they tell you why the esophagus is narrow?
They said that it's with the age factor. I don't know the exact reason. They didn't tell me the exact reason.
Okay. So I think it's time for you to go back to your doctor and say, look, my mom is not able to eat. We do see such situations when somebody is not able to eat. So there are ways to help them out. If you are giving the liquid diet, you can either continue with that, or you can ask that, can I have an alternative way to feed my mom? So if possible, we put the tube in the nose because this is quicker. If you don't like that idea, then we also make a small hole, which is called a Mickey or a Minnie in the stomach, and then you can put the food through the hole. And these days in the market, there are a lot of food items, like you have lots of liquid formulas which you can give through the tube. And now we have plant-based formula in case you're vegetarian. So we have plant-based nutrition, which you can give through the stomach too. And it's very sorry to hear that she's not able to eat. Let me know if I can be of help.
Because she is above 80.
85. She's 85. And the thing is, she doesn't want any tube. She doesn't want anything in her stomach. And that is the main problem.
So is she open to the idea of nutritional drinking? There are nutritional.
I give her Glucerna.
Yes, Glucerna is good.
2 or 3 times a day. But sometimes she throws it up also.
Oh yeah, even Glucerna.
She sometimes she throws up. If she eats anything, any pureed diet she eats, I give her. There is a very limited things I can give her because she had her dialysis. She had diabetic ketoacidosis in September, and I can't give her. And she's on too much medication. She has complications.
Well, yeah. So see, if you have such a complicated system, it's not always your esophagus. If you have, if you are on dialysis, then maybe because your kidneys are not keeping your electrolytes in proper shape, and that can be the reason for vomiting. The second is, if you're diabetic, your motility, the movement of the gut is completely hampered or changed. So if you're diabetic, she may be throwing up not because the esophagus is bad, she may be throwing up because there's an issue with the gastric motility, etc. So they're multifactorial issue here with the vomiting in a person who has other systemic illnesses too. So I guess you need an internist and keep an eye on the electrolytes and the glucose control and everything to keep things under control. It's very tough. It's easier said on my part than on your part to manage it.
Yeah, and can I know you said that there is a plant-based nutritious nutrition diet. Can I know what kind of diet is that?
So
if I can...
Right. So the Nestle company makes it. I don't endorse and I'm not speaker for them, but Nestle company makes multiple kinds of plant-based nutrition, but they come in a pouch. And the one I'm talking about is that pouch can be given through a tube. it's not tasty.
Oh,
So
no. I don't want. She doesn't
if you
want
if
any
you
tube.
don't want tube, then what you can do is you take glucerna and you add some spinach to it and little strawberry to it and make a smoothie kind of it to make it little tastier. Because
Yeah.
every day drinking glucerna, if you give me, I will start throwing up also.
Yeah,
Right. That's the main
that is
problem.
the problem that
That is the main cause.
she throws it up. Otherwise, I changed the taste, but she didn't like
I think
any.
it comes in different flavors.
It comes in very
I did. We can try. We
But
try.
she liked only the homemade vanilla.
Oh,
That is the only thing she likes. At this old age, she is very choosy. She have been very choosy throughout her life for eating, and what she doesn't like.
So
she
the
doesn't like.
easy way in her case is when she's eating and you know she's in a bad mood, put a nice TV and movie on for her. Just like, you know, the extremes of ages, they work the same way, younger kids and older people. So put a TV and a nice program and then let her have the glucerna and change the bottle. So where it comes in a bottle, so give it in a nice, in a different looking glass, so she can enjoy sometimes with a straw, sometimes without a straw. So she will focus more on the TV than your glucerna. So
Can I heat it up? Can I heat up?
it can be warmed. It's advised not to boil it. So you can put in a warm water and put it there. So yeah.
Okay. Thanks. Thank
Yes,
you.
you're very welcome.
Thank for your good advice.
Thank you.
Okay. Thank you.
मैं उनके मेलिंग लिस्ट पर हूँ ना, तो आया था।
Thank you, Abhijit too.
Thank you very much.
thank you, Deepali. It was
Thank
great.
you. Thank you.
Great
And
talk.
have a very good.
It was
Please.
very, very informative, very nice.
Thank you.
Thank you.
Somebody.
to ask something.
Yes, please.
Yeah.
I
think my video is not proper. My name is
I can.
Gent में? Yeah. Video का कोई doctor.
Yes, I'm listening.
Yeah, I have a. Somebody's talking. I can't hear.
I think somebody's.
Mute everybody.
Zoom people.
Everybody can mute, please.
Let me close my video, then I think I can flickering. Okay, my name is Neeru Patel and I have an issue. I was a 9/11 case and I have a acid reflux, right? So sometimes I have like Dr. Rajini said acid reflux, but I have like an issue with that. They wanted to put me on a medicine something, but I didn't want it. So sometimes like I do burp, sometimes I don't. And suddenly sometimes few months ago, above the belly button and between the chest, that between two breasts, the stomach is start hurting. With even morning.
Okay.
I did ultrasound. No, it's normal.
Okay.
Would you suggest like?
Well, what if you don't mind me asking? Don't tell me your real age, but tell me if you are below 50, above 50, below 70, above 70.
I'm 75.
Okay. So I would say at your age, you should get an endoscopy.
Okay.
Yes. And there's no harm in taking the acid blockers. If you don't want something on a daily basis, then at least keep some Tums at home. And when you feel the heartburn and the acid is coming up, just take it as needed, but see a GI.
Okay. But suddenly the pain comes like, and I'm like, you don't know. It's just bothering.
Okay.
Something is happening.
Well, that's why you need an endoscopy to see. As I was saying, in older age, a long-standing reflux can become Barrett's esophagus. So Barrett's is an early stage of cancer. Don't lose your sleep. You'll be fine. But let's get it evaluated.
Okay. So endoscopy. Okay.
Yes.
Okay. Thank you. And do you have anybody suggesting any good endocrinologist, like for the older people?
For the older people you have in Westchester Medical Center, the last name is same, easy to remember. He is the interventional gastroenterologist and his phone number was there. I think I will text you, Dr. Abhi. So you can forward it, right? Okay. And I will text to Dr. Rani Singla also. So you can have the number and please do see.
I took the picture of you like just now when you were giving your numbers.
You're very smart.
No, I took some film pictures of a lot of things, like when I was listening.
Okay.
So this I can refer back, I can refer back.
Well, I knew I was going to a smart group today, so I came prepared.
Thank you. I was trying to concentrate so that I can ask you at the last what was my problem.
Yeah, I'm very happy. I think when I talk to the residents and the students, even they don't pay so much attention as everybody is listening here. So I'm very thankful.
Well, it was a good information lecture. Thank you.
Thank you.
Okay, we are running up about.
All right. So good night, everybody.
So we're going to do a Shanti part before ending. Is Usha ji here? Maybe she can do it, or I can do it. Usha, you want to do it? Shanti part? You're mute. You're on mute.
आप कर दो. You do it.
Okay. Okay. We will all do together. Om Do Shanti Antarikshagam Shanti Prithvi Shanti Rapa Shanti Roshadaya Shanti Vanaspatya Shanti Vishve Deva Shanti Brahma Shanti Sarvagam Shanti Shanti Reva Shanti Sama Shanti Redi Om Shanti Shanti Shanti. Namaste everybody. Good night.
Namaste.
We do this once a month, so welcome. Well, first Wednesday of month.
Rani, is this recorded? Because I missed in the beginning, I was not able to log in.
I think, yes, I think Jitendra ji was recording it. He's the host.
Because I had trouble Zoom connecting it, a lot of trouble there.
I got distracted also because people were calling me that they couldn't
we were not able.
Yeah.
That's why we had trouble.
Few people could not join, so maybe next time it will be better.
Okay.
Thank you.
I think the link in the email was not
working. Okay. Thank you.
Okay. Thank you. Thank you, Jitendra ji, Rakesh ji. Thank you, everybody. Binu, I see too. Hi,
thank you.
Vidya ji, namaste.
Vidya ji is there too.
Vidya ji, Tejwani.
Yeah, namaste.
Namaste. Wow.
मैंने thank you बोला.
आपके क्या हाल है?
प्रेम जी, उषा जी, सबको देखने से बहुत खुशी हुई.
आप कैसे हैं?
चल रही है गाड़ी अभी तक.
अच्छा, but it is so nice to see you after God knows how many years.
I know, I'm seeing her after a long time.
We miss your song, you know. You always sang beautiful bhajans, you know, at the Samaj.
Yes, I try to sing them at home here.
Yeah, very good, very good.
No, thank you. I miss you all myself as well.
Thank you. Of
we
course,
were a good group.
Whenever you get a chance, come by, you know, to New York.
God willing, we'll make it. Yeah. So how are you guys doing?
Yeah, we are doing good. We have this 2 or 3 things we have added to our Arya Samaj. We have the Vedic Study Circle every Saturday at 9:30 a.m. where some spiritual scholar is invited, and from 9:30 to 10:30 a.m. in the morning.
That's Eastern time, so that's probably 6:30 for you.
California.
Right. And the other thing is the Mahila Samaj, where, like this one, first Wednesday of the month from 7 to 8, it is always the speaker is a female who we talk about cooking, we talk about health, we talk about diet, we talk about finance,
medical.
That's great.
So, and then of course we have a Samaj and, you know,
right,
as usual, of course. And so you come by sometime to New York.
I will try to. The presenter, she was excellent.
Yes.
She was really good. Yeah.
Yes.
I learned quite a bit about these things, and so many things can go wrong, right, in our body. And but I hadn't thought about children. No.
Yeah.
Fortunately, my kids, when they were younger, they were, healthy. But now I have grandkids, so I'm thinking about them, right? So
right.
I didn't realize that children can have these things. And there is a pediatric gastroenterologist.
Yeah, she's
right. Like the way I was saying, some foreign body gets stuck there, like the bone, of non-veg thing. So many cases,
Yeah, no, I learned a lot. It was very informative. She was a very good presenter and had her material together nicely. Is she in Westchester or she's in?
She's in Westchester Medical Center,
Valhalla.
Maria Fareri Hospital, Children's Hospital.
Children's Hospital. I see. Okay. All right. Good.
So it will be nice if you can join every time as much as you can.
Right. Yeah. No, I will. I will.
Do you get a flyer? Do you get the Samaj flyer?
This Mahila thing came today, yesterday, I think, email. I said, oh, that's nice. They have started something different.
I see. So we'll send you every time all our activities, so at least you can see from, even the plan and everything,
Yeah,
no. Group all together. We are very young people, younger generation now.
I know.
Feel so old now,
हम बुजुर्ग हो गए,
हाँ? But it's such a pleasure to see them, they are taking over, very nice, very nice.
Right. Carrying
they are very good people. We have Garima Wadhwa, who's our president now, and she's excellent. She's very good, very innovative. She and her whole family, they're very actively involved, and so.
That's wonderful. Wonderful to hear that thing is continuing and flourishing, actually, right? Doing well. Very. You guys started the seed,
We all did. You remember our first hour? The first time when we hosted? We hosted together, and how we raised a hand. They said we don't have any host families, and we are raising a hand. We want to do it. We want to do it. And then when we started cooking, what?
What are we supposed to do?
So much food. I remember. And they had forgotten the key, and we were standing outside with the food and everything. Oh my God, it was something. We had a lot of good memories.
Those were the days, Rakesh. We've come a long way now.
तो आप अभी भी सियाटल में हैं विद्या जी?
हाँ, अभी भी सियाटल में ही हैं. Yes.
Say hello to Manoj.
Sure.
And, lots of love to kids.
Thank
and the
you.
grandkids, of course.
Yeah. What's happening at your end with the children?
At my end, well, Bhavna is married, of course,
yes.
a few years ago. And she has graduated, and she's a rheumatologist now. And her husband is a gastroenterologist.
Oh, I see.
And Manish is, right now he's tutoring ACT, SAT students. and both via Zoom and in person. And he also takes some classes for in the school, when they call a bunch of people, he's busy there at that end.
Where is Bhavna? She's in your area? She's in Boston. It was cold, right, this weekend?
Yeah. And you remember Raniji, right?
Yes, of course. I was just going to ask her how are things at her end and what's happening now. Of course, I remember her. Ushaji dropped off, I think, right?
No, Ushaji is there. Ushaji.
Maybe she's on mute.
No.
How do you know she's there?
Ushaji?
I think she left.
Yeah.
So Raniji,
I'm doing fine. Yeah, I was on mute. I didn't realize I was on mute and I was talking.
Yeah.
It's nice to see you.
Likewise. और क्या चल रहा है? आपके कैसे चल रहे हैं सब?
ठीक है, बस I'm home.
Family.
I'm not working anymore.
Okay, retired, huh?
But busy with other things. Now my life is busier than it was when I was.
He said the same thing.
What keeps you busy? What keeps?
Yeah, just different things. And my family, my daughter is close by, and she has 2 children.
Yeah.
Granddaughters, and I'm busy with others.
Sure.
Temple stuff. We are building a new temple here. And
oh my God! Another
Arya Samaj.
stranger here.
Another what?
Another stranger here. I saw.
Binu.
I know.
How are you, Binu?
I'm good, fine. Thank you. It was very interesting, very nice. Abhiji and all of you all, very nice.
Glad you joined.
I know, I just came from work. I said I knew I would there. And so it was very interesting. I was there in California. And my daughter got a baby boy last in December. Sorry, in January. January. Yeah. Thank you. So she got in early January. So I just got back last week. So it's just interesting back and forth from work. आज मैं देखा मैंने कहा I have to be. I mean, I saw कल ही देखा पहले देखा था.
So since you're back, we want you to come to the Havan.
I will come definitely. I want.
क्या नाम रखा है?
उसका नाम है Asher, ASHER. That's uska meaning है like love and blessings. So we are blessed to have a first grandchild, So
it's a great feeling.
I know. Thank you. It was lovely, yeah. But it's so good to be involved with the Arya Samaj, There's always so much fun.
So I'm going to see you there.
We will. I'll come. Monday, Saturdays, काम पे चला जाता है, but Sundays I'll try, definitely. I will make efforts to come this year, more often.
We celebrated Pongal and Lodi and all
this. मैं यहाँ थी नहीं, मैं पिछले हफ्ते आई, so वो मुझे पता था. अभी आऊँगी जरूर, definitely. But very nice, very interesting, Abhiji and all of you all. Thank you so much, Thank you. Good.
Okay.
Happy New Year.
Happy New Year to all of you.
Happy New Year.
Thank you.
Thank you.
Okay, sure.
Thank you.
Okay,
bye-bye. Good night.
Changa Maharaj.
Thank you, Abhiji.
Thank you.